Pakistan is experiencing a third wave of coronavirus infections, with cases shooting up last month. Doctors say the terrible scenes across the border in India have helped persuade people to take more precautions. But there are concerns that the Eid festival will lead to a dangerous spike. So a partial lockdown is now in place. Sakunda Kamani reports from Lahore.
Friday prayers in Lahore. At this mosque, plenty of masks, but no social distancing. Throughout the holy month of Ramadan, congregational prayers have continued.
मास्क पहन के रखे हैं, सब इस पे अमल करे, कोई मसला नहीं है। ठीक है, तो खुद का कोई खौफ नहीं है? खौफ अल्लाह का सिर्फ, कोरोना का कहाँ पे?
काफ़ी लोग इकट्ठे हैं एक ही जगह में, तो खतरा तो ज़्यादा फैलता है। क्या समझते हैं?
गलत है, ये चीज़ गलत है। इकट्ठे नहीं रहना चाहिए, थोड़ा गैप होना चाहिए। कि जब है बीमारी तो अल्लाह जानता है या नहीं है, जो भी है, लेकिन एहतियात ज़रूरी है।
Beds for critically ill patients in the city have been filling up. In public hospitals, around 75% are occupied. Outside, families wait anxiously. A few weeks ago, it seemed the healthcare system was about to be overwhelmed. Since then, admissions have actually fallen, but the danger of another bigger spike after Eid is very real.
We do believe that there is some level of fear in the mind of the people now about the disease, seeing the horrific pictures from India and from elsewhere. Obviously, we have limited resources, we have limited number of beds really. If the number of cases overwhelm the infrastructure available in the hospital, that is going to be a very, very painful situation.
At this market last week, shoppers with masks but out in force. The lead up to the Eid festival is usually the busiest time of the year for retailers. But now a partial lockdown is in place to try and reduce transmission rates. All non-essential businesses are closed until next week. The security forces have been called in to help enforce the rules.
What happens over Eid is going to be crucial in preventing the healthcare system from becoming overwhelmed. This is an important part of that, but an even bigger challenge is going to be whether families decide to have their own gatherings at home, and that's going to be even harder to control.
The only way we can do that at the houses level is to request and appeal the people to behave more responsibly. Obviously, it is not possible for us to reach out every house and every household.
A vaccination campaign is underway, but it's moving slowly, with under 4 million doses administered so far. For now, all the focus is on avoiding a spike in the coming days. Sakunda Kamani, BBC News, Lahore.